Good afternoon, and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call, unless you are speaking or asking questions. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman Bridges and Susan King Lanier. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions, MHSU IDD TBI system announcements, and updates on Crisis to Care, Inclusion Connects, and Inclusion Works. There will also be time for questions after the presentation. At this time, I would like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you so much, Tina. Hello, everyone. I'm Kelly Crosby, and I'm really pleased to be here with you today. Thank you so much for joining us today. I'm really excited about the announcements and updates that we want to give you today. So I'm going to start the day actually by just doing some general announcements, things that are in progress, maybe some reminders to you, some things to celebrate. And then I'm going to turn things over to some members of our leadership team, and they're going to give you updates on what is happening in our crisis system. Remember, it's a work in progress. You'll get some updates on the crisis system, and then you'll get some updates on Inclusion Connects and Inclusion Works. That's our suite of programs for individuals with intellectual and developmental disabilities. So Ginger will remind you what those are, and Ginger and Tina will give you updates on both of those initiatives that are really, really important to us. All right, next slide, please. So this is Lisa. She's our acting chief clinical officer for mental health treatment and recovery. You all know Lisa very well. She's going to give our updates in the crisis to care space. Next slide. And then we have Ginger, who is our chief clinical officer for IDD TBI in Olmsted, and Tina Barrett, who you all know and love as well, who's our team lead for IDD here at DMH DDSUS. Next slide, please. So let me just do some updates. All right, next slide. So this is Black History Month. So we'll have a variety of offerings for Black History Month. And the first thing we really want to emphasize today is that Black History Month is a time to honor the achievements and contributions of Black and African Americans throughout history, around the world and here in our country, and to our field in particular. So we'll be excited to bring you updates and opportunities throughout the month. And we celebrate and honor all the colleagues and the citizens that we work with here in North Carolina. There is a particular webinar we wanted to draw your attention to. As usual, the slides have a hot link in it. This one is very exciting. Advancing Health Equity, Closing the Gap in Black Men's Lives. We're very excited about this one. We'd love for you to join. But again, please continue to look for additional offerings from our division, but also from the department. Next slide, please. This one is really important. It's a lot of words. It's a lot of words, and it has a hot link, a button you can press when you get these slides. But this, in a nutshell, remember, over the past year, we've been working with you. We've been working with our State Consumer and Family Advisory Council and with you and with the general public in many cases to try to make our system more understandable and therefore more accessible. We worked on materials to explain what the tailored plan was. We worked on materials together to explain what tailored care management was. We worked on materials to explain what the 1915 I option services are. That's a mouthful. And we're getting ready to release additional information. We're working on the information right now with you and with our LME MCO friends on what the innovations waiver is. And remember, the point of all of this is so anyone can understand our services and know how to get them. how to sign up for them, what they mean, because we do think our services and supports can be life-changing, and we don't want lack of understanding or lack of even knowing how to engage these services to be a barrier for anyone. But what this is about, this is kind of a research lab. We want to hear from you. We want to talk about the campaigns we've been doing, the materials we have produced, things that we're thinking of in the future, and we desperately need your feedback. How's it been going? Is it hitting the right spot? What can we do different? So we thank you for your continued partnership. Access, availability, understanding of our system remains a very, very, very high priority for us this year. So please join us, and we really want to hear from you. Next slide, please. So we got an award, yay. But this award is very special to us because this is an award that furthers our work in certified community behavioral health clinics. So you'll hear this year us say more CCBHCs. So we got an award. Usually we give the awards, right? But this award is between us and the federal government, and it allows us to actually work with our current certified community behavioral health clinics, with our partner over at Medicaid, to really fully flesh out what the model of care looks like here in North Carolina and how we're going to pay for it. So this is kind of a pretty important planning grant, right? Certified community behavioral health clinics are really a one-stop shop. So they provide everything from 24/7 crisis care to peer services, to family education services, mental health services for veterans. They provide case management, care management, whatever you want to call it, navigation of services. They also offer screening and connection to primary care. So it's very whole person. We want to make sure people's physical health needs are being met as well. And they can provide other treatment services. So basic therapy services, but part of the design is saying what else? Besides having basic therapy and case management and crisis and peer services, what other services do we think a certified community behavioral health clinic needs to have, and how do we pay for it all? You'll see a picture of us, and I want to lift up my friends at Southlight. They are a certified community behavioral health clinic here in Raleigh. They have multiple sites, but this is one of their Raleigh sites. That's us with the team. We got to see the incredible facility. We got to hear what they've been doing as a CCBHC that makes them different and unique, and allows them to provide flexible services that really help engage people and really help people move into recovery. So it was a really awesome experience. I lift up all the other CCBHCs across the state, but we want to celebrate this grant and know there is more to come. Next slide, please. As a reminder, we released an RFA for funding that supported people involved in the justice system who had mental health, substance use needs, or intellectual and developmental disabilities or traumatic brain injury. It's a mouthful. But so we wanted to make sure that we were supporting three major things with this funding, three major things. LEAD programs, LEAD. These are diversion programs. So people who might get arrested, we want to make sure that we're able to navigate them into services instead of into a carceral setting, so a jail or prison, okay? And that LEAD program is really important. We have them in several counties across the state, but we need more of them everywhere in the state. We also are using the funding to support housing. So when people re-enter their communities after being in prison or jail, it can be really hard to maintain housing. So we wanted to support transitional housing opportunities and also employment opportunities in our community, because we want to make sure that people with mental health or substance use, intellectual and developmental disabilities, and traumatic brain injury coming out of prison or jail got all the supports they could to make sure that they're able to go back to their communities and their families and their lives. We want to do whatever we can to make it successful. We will announce those awards this week. And as a reminder, you will see funding. So hear me say this, play it back. You will see funding for the Piedmont and also the East Coast, okay? We are holding back funding for our colleagues in the western part of the state. This came out right during Helene recovery, and we wanted to make sure that our partners in the West had more time to submit their applications. So no, this is a partial award, but we're very excited to announce those awards this week. Next slide. In case you missed it, Lisa's going to talk about updates in our crisis system. We had a wonderful fireside chat in Teletown Hall. I was there with Shireen and Joy. We were able to talk about peer respite, mobile crisis teams, BHOCs, facility-based crisis, all those jargony terms. For real, it was a live event. It was live via telephone and Facebook. we had 27,000 participants. We were a little startled and humbled by that, but that tells us a lot, right? It tells us that people want to understand how to get help when they feel in crisis. Crisis is very personal, how they can get help, what services exist in our system, what they should do, and how they can find them. So we are so excited that that many people tuned in. Maybe even if a fraction of those folks learned something, and even some of them use some of our services, all the better. So you can watch the replay. Feel free to share it with friends, family, neighbors, colleagues. We tried to do a good job to represent what is available here in North Carolina. Next slide, please. As you know, we continue to promote 988. I bet when I go to audiences now, more and more people raise their hand when I say, do you know what 988 is? It's pretty awesome, y'all. We continue to support outreach into different communities, and we're really excited about this one. Remember last month we had 988 outreach to colleges and universities, specifically historically Black colleges and universities. Well, these materials are specific to barbershops and hair salons. This is a very specific campaign. Once again, we're giving out free materials that any barbershop or hair salon can just reach out, and we're happy to send the materials. We're trying to get the word out everywhere that a resource exists. It's completely anonymous. It's completely free, 24/7, call, chat, text anytime. If you need someone to talk to, you need help navigating the system, or if you're in crisis and you need immediate help, call 988. Next slide. Again, remember, Ginger and Tina are going to talk about Inclusion Works. Remember what Inclusion Works is? It's making sure that people with intellectual and developmental disabilities have the opportunity to work in inclusive settings. So settings for people who have a disability, who don't have a disability, all abilities. And people with intellectual and developmental disabilities can receive the same rate of pay, the same opportunity for promotion and career advancement. That's what competitive integrated employment is. Now, hear me say this. I'm going to say this in case Ginger or Tina forget to say it. They won't. They never forget anything. This is not the only way. It is a way, though, and it's an important way that we need to grow and build. But folks can have employment in a variety of settings, and we honor choice, 100% honor choice. We're very excited about increasing opportunities for folks to work in inclusive competitive settings. And so this is one of our lunch and learns. We do lunch and learns all the time. And this one is around different employment models. So we encourage you to attend. If you're a family who's interested in what's out there, if you're a person yourself with lived experience, you're interested in what's out there. If you're an employer, if you're a provider of supported employment services, listen in, find out what is available, right? So we're very excited, and we're very excited about the partnership we have with all the supported employment and day program providers right now. We're grateful to you. Okay, next slide. Okay. Wanted to remind folks that we have something called the Connections app. I don't know if you remember the Connections app. We talked about it. The Connections app kind of has two purposes. The Connections app is to help people who are in their substance use recovery journey. It's just a way to connect with peers 24/7 on the app. It's actually staffed by peers. It's really cool. This is not to take the place, of any particular treatment that you might be attending, but it is another support tool, and we love any kind of support tool. Hundreds of providers and consumers are signed up to use this tool. Providers are offering this tool to people coming to their services, so that's very exciting. But there's also another function on it. It's a peer-to-peer support app. We have hundreds of peers now signed up using this app to support one another. So we are going to have a lunch and learn on the Connections app, just so you can learn more about it. Because again, we think it's a really valuable tool. The feedback we get from it is extraordinary. People love it. They feel that it's very helpful. They feel they're able to connect with peers, and we want that. So please come to the lunch and learn if you don't know about it to learn more about it. Next slide. I'm going to tell you about a couple of conferences we have coming up. Now, there's several. We didn't get them all today, but we're going to talk about two really important ones. We have a phenomenal new partnership with NAMI. Very excited about this. You know that we have supported crisis intervention training and crisis intervention teams throughout the state for many years. We do this in partnership with providers, with LMEs, with law enforcement, with counties. But we are really taking this year to do a reset and a lifting up of crisis intervention training. It's really critical that we set a goal for ourselves in North Carolina to have as many CIT trained officers as possible in every county, and that those officers receive continuing education. So we are taking this time in partnership with NAMI, in partnership with our law enforcement colleagues, to do a reset, to say, hey, we've been doing good work, let's celebrate it. But let's take this conference time to renew our commitment to CIT and to set some goals for having more officers trained this year than ever before. So this is the conference. Come on down, come, I'll be there. My team will be there. The awesome NAMI team will be there. We invite you to come. So that's this conference. You'll see us advertising it. Okay, the next conference, incredibly near and dear to my heart. There's a lot of acronyms on this one, right? So this conference is a partnership between us and the Governor's Working Group on, I'll tell you what that acronym is, service members, veterans, and their families. So that's me, right? I'm the child of a veteran. I'm the grandchild of a veteran. And so that means me. It could mean you if you're a service member, if you're a veteran, if you're a family member. This summit is very much about making sure that we are talking about, communicating, lifting up, and doing more of best practices in mental health and substance use treatment for veterans here in our state. So we'll learn and listen from each other. And it's always a good time to renew our commitment to supporting the needs of our active military, our veterans, and their family members. So we'll not only talk about mental health and substance use treatment, we'll talk about all those additional supports that really help families, veterans, and active service members. We've got a lot of exciting panelists. Please come. It's the McKimmon Center. You don't want to miss it. Okay, next slide. All right. So in a moment, I'm going to turn things over to Lisa DeChantis. She is our acting clinical director for mental health treatment and recovery. And she's going to give you crisis updates. Remember, I don't have to tell you this, right? Crisis is a big priority for us here at the division. It's a priority at the department. One of the first briefings I gave to the new administration, the new incoming administration at the governor's office, was on all the work we have been doing in the crisis space. There's much more work to be done, y'all. So much work to be done. So don't be surprised. We give you updates all the time around this work, but we're committed to it. We're committed to seeing it through. So I'm going to turn things over to Lisa, and she's just going to give you some updates about what has been happening and continuing to grow and develop in that crisis space. Over to you, Lisa.
Thanks, Kelly, and thanks everyone for having me here. If we can get right into the next slide, please. So we are going to show you our new crisis services website, and this is our new landing page here at DMHGD-SUS, and it's very easy and searchable. And we're going to actually live show you what it can do, as well as put the link in the chat for you for later. So this is going to give us the opportunity to look at our crisis services and then also search and see what the web page can show you. Are we able to switch over to the page? There we go. Thank you. So this really just highlights that there is help here 24/7, and that if there is any reason to reach out, that you can reach out. It also identifies that asking for a CIT or crisis intervention team officer, if you need to call 911 is the way to go. So when you come to this, it really talks about what we've talked about. There's always someone there to connect with. There's always someone to respond, and there's always a safe place for help. And if you need to call or text or chat with our 988 Suicide and Crisis Lifeline, you can do it with a click of a button here on the website, either on your phone or on your home computer. You can also click down below that says have help come to you. And when you click on the have help come to you, you're able to actually search by your zip code, by just putting your zip code right here in this little box. And the appropriate mobile crisis team that covers your area will come up with their contact information that you can click on. So having help come to you is very easy to find. And then
put in a zip code. Show them how it works.
Sure.
Put in 27587. Just put it in there. 27587.
So
there
you'll
you go.
see
It
yep.
works.
Therapeutic
I knew that was who would
alternatives.
come up because that's my town. So that's who I call.
and their phone number, and you can reach out directly to them, and that's wonderful. Thanks, Kelly. So yep, this is an easy, and works in all 100 counties. And so if we can go back to the previous screen where it will show a safe place for help, you can click on that. And it will show you, it will be able to provide a searchable map again for our behavioral health urgent cares and for our facility-based crisis centers. And again, we can put in mine, which is 27571, and you will, I think, get the same area as Kelly, which is what is showing up right here. It's the Wake Recovery Response Center and the Wake Behavioral Health Urgent Care. And by just clicking on their information, you will get a map. If you are on your phone, you can get the directions right there, and it will come right up on either whatever map system that you use. Really trying to make this very easy, give the information for people to get that information to them and be able to find the closest crisis center to them. As our new centers open, we'll be adding more and more information to this. Thanks so much. We can go back to the slides now. So again, there is the link. The link is in the chat. We are, like I said, we're going to be continuing to make updates to our website, and we'll be sharing those with you as we do. But we want to make sure that you knew that it was really easy and really searchable to get that service, whichever one that you're looking for. Next slide, please. I want to give some updates on our BH Scan, which is our behavioral health statewide central availability navigator. And what does that do? That is our entire crisis technology platform that we are continuing to build, and it is continuing to help us with not only reaching into our crisis services, but identifying services and bed availability. Right now, this is our bed registry platform, and that helps us with reducing ED stays. It helps us with enhancing that coordination, really getting those highlights and really getting the information from all of our facilities out in the community to really help to get people the treatment that they need faster. It gives us availability of beds. It will help us with generating digital referrals to make those connections to hospitals that have beds available much quicker. It gives secure communication between the providers so that they can chat right in that system. It gives us updates and notification, and it also gives us some reporting. So we're able to see the beds that are available in the communities. Next slide, please. Right now, we have 59 different provider facilities in there, and that makes up about a little over 3,100 beds in our system. And about 74% of our over the last 3 months, about 74% of the facilities are updating their bed availability every 24 hours. And this is really, it helps us to understand what beds are available, and where they're available, and how we can then take some of the other data to look and see where we need additional beds. These are the facility types that are in the system right now. We are continuously onboarding new facilities as they come online, as we continue to grow. We started with our community psychiatric inpatient hospitals, and then we have continued to grow with all of the other types of bed facilities. This is our 2-year anniversary. January 31st marked 2 years since we launched this bed registry. So that is really, just wanted to highlight the continued value that this has added to our crisis system over the last 2 years. If we want to go to the next slide. So it is showing us data. This is showing us from January 1 to January 31st, the average beds that were available on a daily basis. Now, remembering that this is a point in time. So when a hospital or a provider goes in and updates their bed, and this is, it's identified at that point in time that they update their bed availability. So this is for all ages, and this is for all of the different facility types that we had on that list on the previous slide. In our next slide, we highlight the beds for youth during that same time period. And again, this is a point in time for those beds, and it is inclusive of all of the different different levels of care that were identified a couple slides ago. We're continuing to grow this network again to make to really update the beds and when they're available. Next slide, please. So when we look at this slide, we're looking at the operational beds. So the beds, all this represents all of the beds in the community that are available in all of those levels of care. So when we look at, you know, that these are the potential beds that they could have, but when we look at that previous slide, especially with the children, there are a lot of areas that don't have any beds, or even on all ages, that there really are very few beds that are available at any given point in time. This helps us with identifying where we need to look at additional beds and how we need to the different ages that we need to look at for those beds as we continue to expand the crisis portfolio. Next slide, please. We have a couple of really exciting centers that are opening in the next about 6 weeks here. We have 3 different behavioral health urgent care centers that are opening up. The first one being in late February, and then we into early March and then late March. So we are really excited that these are going to all be 24 hours, 7 days a week. They are going to be facilities that anybody can walk into, and they will be added to our Crisis to Care website, our access. So you'll be able to find those, get those addresses as soon as they open and they are operational. So we are really excited that these ribbon cuttings are happening and these doors are going to be opening for additional support in the communities. Next slide, please. We are excited that we are going to be, we announced last week that we're going to be working with Trillium Health Resources, and we are going to be continuing to expand upon the crisis centers. We'll be opening, we'll be working with them to open Lenore, New Hanover, and Pitt counties. These are going to be able to offer services for everyone in those counties and the surrounding areas. They are going to be those really critical places as alternatives for emergency departments, and they are going really going to be well received in those areas. And as we continue to move forward on that, we'll do the announcements of when they're actually going to be opening. But these are partnerships that are starting, and that work is starting to get underway. I know that we have shared this in the past. We have our request for proposals that is live. The link will be put in the chat. We are investing $20 million in that non-law enforcement transportation for individuals to get from one setting to another setting for their psychiatric treatment, either in a facility-based crisis or an inpatient hospital. This is something that we've been working on for quite some time. Those proposals are due on February 28th. All of the information is linked there in that link that was just put into the chat for that pilot program. Next slide, please. And now I am handing it over to Ginger. Oh, or
Hey,
Kelly.
Ginger, can I interject just really quickly? So thank you so
course.
much for going through that, Lisa. And I just wanted to stress something before we switch gears, because it's actually a good segue into, I think, what Ginger and Tina are going to talk about. So one of the things that we know that we need to improve overall is the quality of services, whether it's from a mobile crisis team or from our urgent care or our facility-based crisis. We're calling those community crisis centers because our jargon is confusing for people. So I want to say that when I say improve, that means we want to improve response time so mobile crisis can get there quickly. And the staff who comes are incredibly well trained. Maybe a peer is there as well. And they really can help de-escalate the crisis and not actually transport people. On the facility-based crisis side, a couple of things are happening in that space. One is just trying to make sure that there's consistency. So what we don't want to happen is to advertise all these community crisis centers and then have some turn you away if you have a certain level of physical health issue. Some turn you away if you have a hinted dementia. We don't want crisis centers turning away people if they have autism in a crisis or intellectual and developmental disabilities in a crisis. We also want our facilities, all of them, and we're close on this one, y'all, all of them to be 24/7, 365, and to also have detox and induction. We're close, we're not there, right? We still have a couple of legacy BHOCs that are maybe only open 10 hours a day. So we're trying to fix that. And some places that don't do detox and induction, but we're very close to much more uniformity. That, and here I'll pitch, you don't have to answer this question, Ginger. It's more, I want to tell the community that an area of particular focus between Lisa and Ginger has actually been crisis response for people with intellectual and developmental disabilities, autism, and a mental health or substance use crisis, right? And remember, crisis is very personal. So a lot of times these individuals and families maybe have not had a good experience with mobile crisis or have gone to a facility-based crisis and their needs have not been met because, and even I'll be honest, we've had situations where a caller may triage or a facility may be like, oh, you have autism? Can't do that. And that's not the system we want in the future. So we've really been exploring ways to make sure that we are equipping facilities with additional staff, resources, dedicated rooms or beds, or even alternative spaces in crisis situations for people with intellectual developmental disabilities or autism and also mental health and substance use. It's a real need for us as a state. We know that. So know that as a priority. And know that coming up, we will have some ideas that we talk with our advisory group about and we'll share with you here too. But know that we have not solved that one yet by any stretch, but it is a priority for us. So with that segue, I'm going to turn things over to Ginger to talk about Inclusion Connect.
Great. Thanks, Kelly. Good afternoon. As Kelly said earlier, I'm the director of IDD, TBI, and Olmsted here at the Division of Mental Health, Developmental Disabilities, and Substance Use Services. And I'm here to share some exciting updates about Inclusion Connects and Inclusion Works. Just as a reminder, Inclusion Connects is our statewide cross-divisional IDD system here at the Department of Health and Human Services. I also want to level set quickly around the consent order that we are under with Disability Rights in North Carolina. So this came out of what is often called Samantha R. This litigation started all the way back in 2017, and over time there were court dates and appeals, and eventually at the end of 2023, the state and DRNC started drafting out a consent order to outline an agreement. The consent order was finalized in April of 2024, and it is in place for 2 years. This does not mean that the litigation is over, but it does mean that we're working towards progress instead of necessarily heading right back into the courtrooms. So throughout the next year and a half, we're going to continue to meet with DRNC and continue to report out all of our progress to our community. Next slide, please. Right. Again, Inclusion Connects is the cross-divisional system that supports people with IDD, and this means all people with IDD. So regardless of level of skill, age, or where they choose to live. So everybody with IDD in North Carolina is included. The goal of Inclusion Connects is to support individuals with IDD across the lifespan to live their lives where they want to live with the services and supports that they need. We want to provide choice, so choice of housing options and services, and finally, we can talk about services and access, but for true access, we have to address our direct support professional workforce shortage. And throughout all of this work, we're committed to providing data and transparency to this community and to our community. As part of the consent order, there are reporting requirements, but beyond that, we're doing this because we have to have good data to know where we are now and if our efforts are doing what we think they will do. Next slide. Okay. On January 15th, we produced our first full Inclusion Connects quarterly report. And I'm going to walk through some key highlights and some insights that we've seen. First, I want to openly acknowledge that this is not a super easy read. So if you've seen it, it is super dense, super wordy, but we are working on something that's a little bit more digestible and just to make it easier to read so you're not trying to decipher through all of our lingo and numbers. I also want to acknowledge that the reporting sources for this data in this report are through our tailored plans. We've worked closely with the tailored plans and their subject matter experts, their data teams to provide this data through reporting templates on a regularly scheduled cadence. So for anyone who's ever thought like data just comes in and it sits on a shelf, I can assure you that that is not the case when it comes to this data. We're using it to better understand what's happening in the community and guide our work. Next slide. You are already ahead of me. Good. One of our first steps to improve data transparency was the release of the new Innovations Waitlist Dashboard in December. This has some dynamic capabilities to slice and dice and sort the aggregated data. So please take some time to explore it if you have not already. The dashboard provides lots of information about who is on the wait list, but also leads us to ask more questions. So right now we've started with the data that was the most comprehensive and reliable. And we're planning to add more functions around use of services, where are people living, and those types of things in the future. I did just hear from Tina earlier today that we are expecting an update to this dashboard, hopefully this week, if all goes according to plan. Next slide. All right, so one of the things that we report out in this is transition and housing data. And this is around diversion, in-reach, and transitions of people with IDD. And when we're talking about this, we're referencing diversion, in-reach, and transitions in the institutional settings. So, and those are ICFs or intermediate care facilities, state developmental centers like Murdoch, and skilled nursing facilities and the like. In-reach is where someone meets with the individuals and their caregivers to talk about the options for transitioning into a community-based setting. I want to be clear, we're not trying to force anybody to do anything, but instead making sure that people know what their options are. Sometimes people have been living there for years, and that was before we had 1915I available, for example, or they may not know that the innovations waiver is available. And so we want people to know what their choices are to make good decisions. On this chart across the state, you can see we have 1,168 individuals who are actively engaged in in-reach efforts. And that's about 48% of those in an institution. And we have 390 individuals who are transition planning after the in-reach was done. So they're like, yes, I'm on board. Let's look into it and see what's available for me. And finally, transition. This is about those who were in an institutional setting who have transferred into a community setting. Are they able to do so in a timely manner with the supports necessary to have the life they want? Last quarter, we saw 12 individuals transition out of an institutional setting across the state, but we are looking into that more. There may be more out there that we just didn't capture this first round of reporting. Next slide. And here are some specific activities that we're working through. And I asked Tina to be on so that she can show you the community living guide in real life. Go ahead, Tina.
I am going to grab the screen, I hope. That is not the screen that you should be seeing. There we go. All right, so hopefully what you're looking at is the Inclusion Connects webpage that is available on the North Carolina DHHS webpage. Ginger, would you nod if that's what we're looking at? Okay, thank you. I just wanted to make sure. So if you go over to the webpage for Inclusion Connects and scroll down, You'll see some tiles at the bottom. You'll also see our link to the Innovation Waiver Dashboard that Ginger referenced. But if you continue to scroll down, one of the things that you will see is Community Living. And in the Community Living tab, when you click on that, it does take you over to the Community Living Guide. Now, this guide is really exciting, and I enjoy going over to look at it because I always find something new and different every single time that I go over to take a look at it. There are 3 drop-down menus that are associated with that. There's a Find Housing drop-down menu, and under the Find Housing drop-down menu is the place where that you would look for shelters or for housing that are near you. You can find immediate shelter options as well as some housing resource, contacts for housing information. It also allows you to search for housing near you and explore a wide range of community-based living options across the state. Finding Funding, the drop-down menu option, allows you to look for funding and financial assistance. It's an opportunity to learn more about getting help for paying for supported and independent living options. It's also a link to some voucher programs that you may be eligible for, as well as receiving financial aid for rent, utilities, and other home costs. And then under the Find Supports drop-down menu, there's an opportunity to explore some resources for successful and healthy community living options. Those are resources that are accessible related to modifications, assistive technologies, as well as supports related to food and nutrition, transportation, social supports, caregiver supports, and others. I'd like to go ahead and mention to folks so that you're aware, this is not an all-inclusive document. We are in the process of building this out. We're looking forward to being able to add to it as we move forward. So as you go and explore, if you find things that are missing that you are aware of, we would love to be able to have those links so that we can include them here as well. I am going to drop under the Find Housing. So if you click on the tab, it will show you some of the options that I just talked about. You can see where it says Need Immediate Shelter, and there are some links there that you can click on to help find some of those services. So how to get help if you're experiencing homelessness. When you click on the link, it does take you over to the North Carolina Coalition to End Homelessness. And this is an opportunity where you would be able to find different shelter options, take a look at accessing food and healthcare to help prevent homelessness within that setting. I always use my little to go back. So again, with finding some housing contacts, there's the link to the Housing and Urban Development, or HUD. I'm very happy to say that prior to Secretary Kinsley leaving, we did have an opportunity to gather his support. We've requested that folks with IDD be added to the remedial housing. So they will have an opportunity to have first priority when it comes to housing options, which is very exciting, or second priority, I believe it'll be second priority, but still moving up on the housing list, which is really exciting for folks with IDD. There's also a link here for DHSR licensed facilities. So if you wanted to go and look there, there's an opportunity to search for housing, to look, and you can put in like low-income apartments and affordable housing. When you click on that link, it does actually take you over to a housing search. You can actually go in, input information, and help find some low-income housing in those settings. I think I have pop-ups coming up. So continuing to go down, there's also some more information about some different types of community models throughout the state that are in the process of being developed. I would like to just comment and note that here, our goal with this is to create a sort of one-stop resource for folks to be able to find different things. We don't endorse any of these particular items. We're just looking to include them so that folks can have the options that are available to them moving forward. There's also some information about some home ownership resources if folks were interested in exploring that, and as well as some county-specific housing resources. Under the Funding tab, if you click on that, that will also take you to some different links looking at getting help to pay for supported and independent living, exploring some financial assistance options, including the Mainstream Voucher Section 8, as well as Emergency Housing Voucher Program. Those are links that can take you over to those sites to get more information, to apply where it's appropriate to apply, to see if you are potentially qualified for any of those particular programs. There's also some financial assistance options and North Carolina Medicaid programs. Those links are included here as well. And then there's some links as well for housing developers that may be interested in helping to support our communities. So finding supports, which is our last link, crisis services are included here. We also look at some natural disaster and hurricane resources that are still in place. We work to update this on a regular basis to make sure that the links are current and they're available and provide the information that we believe that they provide. We don't want folks clicking on links and ending up somewhere that is no longer active. There's also help for accessibility modifications and technologies. If you're looking to have something added to your home, if you need a ramp or something like that, these are some areas that might be helpful as you're exploring to help have those funded or potentially find contractors to be able to provide those services. And then there's additional community supports as well. And there's a long link to these. So I would encourage you to take an opportunity to walk through all of these different options, take a look and see. And please let us know if you're aware of some resources that are potentially available that we have not included. And I think that's all. So again, contact information for these resources. We're also in the process of developing a printed guide, which is not quite yet available, but certainly when that becomes available, we will make sure that folks are aware of that so that that can be requested as well. Ginger, I think that's everything that I have.
All right. And then if we can go back to the slideshow. All right, so thank you, Tina. And again, we're also continuing to explore the housing barriers and standardizing the informed decision-making process in Reach. We are also looking for some success stories to share. You can hear about housing and transitions from all sorts of professionals, and we use all the lingo, but there is a different type of feeling when you hear from someone who's lived this experience. So we would love to get in touch with people that have some success stories that they would be willing to share with us. And again, we last month they did submit the request to HUD, and it's called the remedial preference. It's a terrible term for it, but it is to include people with IDD to be included as a priority population. All right, next slide. Okay, so what about the folks on the wait list and those who are already living in the community? What do services look like? Keep in mind, this is for 1 quarter. Our reporting period is July 1st through September 30th on 2024 on this report. We saw 2,164 individuals with IDD go through the 1915I assessment and eligibility process. That means they said they were interested, their care manager came out and did the assessment, it went through the state's Carillon process, and eligibility was determined. We also saw that 10,414 people with IDD received 1915I services during that quarter. I will say we honestly did a double take on that and reviewed that number a couple of times, but it is accurate. We did it based on claims. So there were over 10,000 people to receive 1915I services. However, I did want to point out 36% of those on the wait list receive services. If you're looking at kind of the numbers, you can tell that those 10,000 people are not necessarily on the wait list. So there is room for improvement, absolutely, on that 36% receiving services. Right now, during this reporting period, there were 18,457 people on the wait list. When we do our update refresh sometime this week, you'll see that number go up, which is expected. We do expect the number of people on the wait list to actually increase over time to a degree as we're getting better at communicating out that we have a wait list and around services. But we also expect to see the percentage of individuals receiving services while they're on the wait list to increase as well, due to those access and education efforts. Next slide. So how do we plan to improve access? One, we have to understand the needs of those on the wait list better. We have a dashboard, it's great, but we need to know what the needs of those people are. So we're working on a plan to assess the needs of each person that is on the wait list. This is going to require some standardization across the board, and those discussions are just starting with our tailored plan partners and will be discussed at our advisory committees as well. Next slide. And I'm sorry for going so fast. I'm trying to get everybody out on time. So again, access is more than just having a service or a plan or authorized hours. We have to have a well-trained workforce. So we can approve all the hours in the world, but if nobody's trained to do the work, it's kind of a moot point. In case you're not aware, we do have a multi-year DSP workforce work plan that is posted on our Inclusion Connects website. We're working with our larger direct care workforce work groups as well to address workforce issues in a thoughtful way across all systems. When we're looking at workforce, we're looking at utilization rate of community living and supports to determine really how well are we doing? How is our workforce doing? As you can already see with these numbers, there's some glaring issues here. We have 2 tailored plans that reported 80% of the CLS hours authorized are being used, while 2 others are reporting that less than 40% or less are being utilized. It's a pretty big discrepancy. So we're meeting with our tailored plan partners to better understand this. I'm hoping it's a data collection error in the positive, but we'll know more as we talk with our partners. We're also reviewing the tool itself, just to make sure that's not contributing to confusion. Next slide. All right, a couple of our specific activities include our DSP provider and employer of record incentive grants. Those closed back in December. We were hoping to have that announced last month, but we ran into a bit of a snag. But that being said, we're expecting to announce those awards any day now. We're also building out a standardized core competencies program so that DSPs can get transportable core competency training that they can take with them. And we're working with our North Carolina Community College system to create an advanced DSP program with credit-bearing courses. So if someone wants to take the courses to become a DSP, they can then apply those courses also to an associate's degree. This is expected to launch in the fall semester of 2025. So be on the lookout. Some more information is coming on that. All right, inclusion work. Are we on to inclusion works now? All right. So this is the cross-divisional efforts to support a person's choice on where and how they would like to work, and including competitive integrated employment. Next slide. Keeping with the theme of transparency and data sharing, Inclusion Works is going to be launching our first data one-pager. This is going to include quarterly data that's shared with us from our providers and tailored plans regarding the employment of individuals with IDD. Wanting to know more about supported employment services, who's working in CIE, and people that are making the transition. The screenshot here is not real data yet, so please don't take this one as gospel. It's just an example of what this is going to look like when it comes out. We're expecting to publish it in about a week, so hopefully on the 10th. Next slide. You can actually skip this one and go straight to the next one. As you can see on this slide, we have several training opportunities for those providing employment services, and these are designed to educate our employment DSPs, the direct support staff and the professionals that are supporting people with IDD to attain and maintain CIE. So these are all really exciting, and there's some links here. We really hope people take advantage of these training opportunities, in addition to our lunch and learns. Next slide. And finally, this is the one that next slide, please. This is the one that I really wanted to get to. We cannot transform our system without our providers. So we're going to be launching a provider innovation program led by WISE. WISE is a national expert on competitive integrated employment. This program we're going to start with just 2 providers who are committed to transforming their organization to support competitive integrated employment. And this program includes mentoring, technical assistance, change planning. And because we know that anytime you're doing a whole organizational change, it's not easy and it's going to take resources, we're also including an incentive program for participating. So be on the lookout. An email should be coming soon with information on how to apply. And I think I made it through. And I'm handing this back to Adam.
So Ginger, I'm actually going to take it because we are low on time. But Adam, please know everyone in the background, we've received all your questions and Adam is helping to moderate them behind the scenes. And so what I'm going to try to do really quickly in the few final minutes is to address some of the questions that we got. We were able to answer some in the chat and some in the first half when we did the crisis presentation. So I'm going to go with themes. We've gotten some wonderful feedback in the questions about the resources in the community living guide. So we were asked everything from how do you keep everything in there fresh, or I have some information that is fresher and you could stand to beef up this section. Thank you for that. We strive to keep this as fresh as possible, and we're always eager to hear of new and existing resources. I'll say something too about the community living guide. We're very proud of the community living guide because we do think, you know, part of access to services is quantifying what is available and communicating that as effectively as you can to people. Does that mean it solves all the problems? Absolutely not. So that's what I want to stress. And I heard Ginger say it once or twice, but I'm used to listening to Ginger and I know her plan. I get to meet with her a lot. So a lot of what's happening in all of this space, including that housing space and the supports that people need to live in the housing of their choice, is gathering what we do know. And that includes what we do have, where the gaps are and where the pain points are. And so I heard Ginger reiterate, I just want to reiterate that again and again. A lot of this is just us sharing step one. And we know that when we share step one, you're going to be like, well, what about all this other stuff? We agree. We agree, trust me. But step one is really gathering and sharing the information that we do have. And gathering the information, whether it's through the innovations waitlist, whether it's through some of these discrete reports from LMEs, whether it is through collating all the housing information that we can find in housing supports, whether it's gathering an understanding of all the housing stock we have, how many ICF beds, how many group home beds, how many people get supported living, how many people are in an independent apartment with technology. Knowing all of that and sharing it with you so you see what we see helps us to determine what actually we need. What are the needs of people on innovations wait list? How does that match the stock that we have? How does it match the services that we have? So all of that's in process, but we don't want to stop from sharing what we do have now data-wise and what we do have now in terms of resources. So thank you for all of that feedback. We got another question and I want to hit on this one. Folks are asking why when we talk about Inclusion Connects, is it very specific to people with intellectual and developmental disabilities? Great question. So I want to encourage folks, if you can, to attend a lot of these webinars. So Inclusion Connects and Inclusion Works is fairly, but not entirely specific for people with intellectual and developmental disabilities. Some of that is due to, we're talking about things like innovations services, for example, or that Samantha R settlement, where we have to make sure that people with intellectual and developmental disabilities have opportunities to live in the most integrated community setting of their choice, right? So that's why these initiatives are focused there. That does not mean that we're not doing lots of things for people with mental health issues or people with traumatic brain injury. One of the things we hope to bring to you soon is some more information on what we're doing in the traumatic brain injury space. So our strategic plan, actually, one of our goals is to increase the number of people receiving traumatic brain injury services. So we're actually looking at what we're doing with state dollars currently in that space. And also we're working with the community and Medicaid on the expansion of the TBI waiver so more people can get services, but we'll give you an update on that as well. So lots of things happening in all the spaces. We just wanted to make sure that we did an update. It's been a while since we did an update on Inclusion Works and Inclusion Connects, but truly appreciate all your feedback and your comments very, very much. So thank you very much for joining us today. And I thank Lisa and Ginger and Tina for their expertise. And I thank everyone in the community. I really hope, like, here's my big hope. I hope that when you see the work, you see yourself reflected in it. There's people today that when I look at who's here today, when I look at questions in the Q&A, you are the people that are our community and the folks we are listening to and working with every single day. So we're grateful that you're here with us today, and we hope we're being good stewards of the information that you're sharing with us and building a better system together. So it's very much a work in progress, but we very much appreciate you. please come to Side by Side, join any of our advisory committees, join our mailing list. We send stuff out all the time. You might get tired of it, but we try to over communicate because we want you to know what's going on. So thank you very much for joining us. And to wrap us up, I'm going to turn things back over to Dina.
Thank you, Kelly. If we did not get an opportunity to answer your question during the webinar, questions and feedback are welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's event will be posted on our Community Engagement and Training webpage. The links are included in the chat. There will be a brief survey following today's webinar, and we would appreciate your time completing it. Our next side-by-side webinar is scheduled for Monday, March 3rd from 2 o'clock to 3 o'clock, and we look forward to seeing you then. This concludes our webinar for today. Thank you for attending.